Welcome to the Explainer. If you're prepping for the NCLEX, you already know endocrine questions can be a real beast. Well, today, we're going to tackle a big one, hyperthyroidism. We're going to cut right through all the textbook fluff and get to what you absolutely need to know, what to spot, what to prioritize, and what to do to ace these questions and be a safe, amazing nurse.
So here's how we're going to break this down, and you'll notice it's set up just like the NCLEX's clinical judgment model. We're starting with a patient scenario, we'll recognize the cues, analyze the data, figure out our priority actions, and then we'll dive into what happens when it all hits the fan. Let's do this.
All right, picture it. You're on the floor, you get this report, tachycardia, major weight loss, anxiety. Your nursing brain should already be firing on all cylinders. These aren't just random problems, right? They're clues. They're telling you a story. So the big question is, what's the story here?
And that leads us right into our first step, recognizing the cues. Because before we can do anything, we have to understand the why. What is the one thing that could connect a racing heart, a shrinking waistline, and a mind that just won't shut off?
And here it is. It all boils down to the thyroid gland just going haywire, pumping out way too much T3 and T4. Just think of those hormones as the gas pedal for your entire body. In hyperthyroidism, that pedal is smashed to the floor and it is stuck there. Everything, and I mean everything, is running too hot and too fast. Now, this is a little detail that the NCLEX absolutely loves to test you on. Where is the problem actually coming from? Is the thyroid itself just going rogue? That's primary hyperthyroidism. Or is it just following bad orders from higher up the chain of command, like the pituitary gland? Figuring this out is the key to understanding the labs, which we're going to look at next. And if you keep that body and overdrive idea in your head, all of these symptoms just make perfect sense. The heart's racing, right? Tachycardia. The body's internal furnace is cranked to max, heat intolerance. The digestive system is on fast forward, diarrhea. And you really want to pay close attention to exophthalmos, those bulging eyes, because that's a huge telltale sign, especially for Graves' disease. Okay, so our assessment is screaming hyperthyroidism. But a hunch isn't good enough in nursing. We need cold, hard data to back it up. So it's time to analyze those cues and see what the labs are telling us. Okay, stop and screenshot this if you have to. You have got to know this cold for your exam. In every single case, T3 and T4 are going to be high. I mean, that's what the disease is. The real detective work is in the TSH. If the thyroid itself is the problem, that's primary. The pituitary gland sees all that extra hormone and slams on the brakes, so TSH goes low. But if the pituitary is the problem, secondary, it's the one yelling at the thyroid to work harder, so TSH is high. You have to get that inverse relationship down. All right, now for the part that really matters for the NCLEX, taking action. You've done the assessment, you've checked the labs. What are you actually going to do for this patient? And more importantly, what are you going to do first? Your number one priority, without a doubt, is to protect the heart. That constant high gear is putting a massive strain on the cardiovascular system. We're talking risks of dysrhythmias, even heart failure. So this is where you jump in first. Get that patient on a cardiac monitor, watch their vitals like a hawk, and get ready to give those beta blockers to slow that heart rate down. So once the heart is a bit more stable, you've got to deal with that hyper-metabolic state. And you can think of it as a two-part plan. First, you have to fuel the machine. This patient is burning through calories like crazy, so they need a high-calorie, high-protein diet. And second, you have to calm the machine down. A cool, quiet room with low stimulation, it helps lower the metabolic demands on the body, and it can really help soothe all that anxiety and irritability. Now let's talk about a very specific intervention that's so important. Exophthalmos is not just a cosmetic issue. When the eyelids can't close all the way, the cornea can dry out, and that can lead to ulcers and even vision loss. So your job is to lubricate with eye drops, protect with sunglasses, and yeah, if you have to, gently tape those eyes shut at night. This is a key nursing action that prevents permanent damage. So we have a good plan for our stable patient. But as nurses, we always have to be thinking about the worst case scenario. What happens if a stressor, like a bad infection, pushes them right over the edge? Well, that's when hyperthyroidism can explode into a life-threatening emergency known as thyroid storm. And let me be crystal clear here. A thyroid storm, also called thyrotoxicosis, is a full-on lights and sirens medical emergency. The body's metabolic rate gets so ridiculously high that it can cause multi-organ failure, and yes, even death if it's not treated immediately and very aggressively. So, the signs of a thyroid storm. You basically take all the symptoms of hyperthyroidism and you crank the dial up to 11. The tachycardia and hypertension become extreme. The patient spikes a dangerously high fever. Their anxiety turns into full-blown delirium and confusion. Every single system in the body is at its breaking point. In this kind of emergency, your priorities have to be laser-focused. ABCs, right? Airway is always number one, period. After that, your goal is to bring everything down, and bring it down fast. Beta blockers for the heart, antithyroid meds to stop the hormone factory, and antipyretics to get that fever down. And here's a classic NCLEX trap. You give acetaminophen, not aspirin. Why? Because aspirin can actually make things worse by increasing the free thyroid hormones. You have to remember that.
So, you did it. The crisis is over, the patient is stable. But your job as the nurse is not done, not even close, because now the long-term challenge begins. A lot of the treatments for hyperthyroidism, like radioactive iodine or even surgery, can end up pushing the patient into the complete opposite problem, hypothyroidism. So your entire role shifts from managing a body in overdrive to educating a patient on lifelong hormone replacement. Mastering this topic isn't just about the crisis, it's about understanding the entire journey. And that's the full scope of nursing.